Good day, dear colleagues. Kirill Yurovich, let me thank you first for inviting me to a surgical forum to discuss rehabilitation. This is quite a breakthrough of philosophy because the surgeons usually don't talk about rehabilitation. And now I'm going to tell you what's going to happen to your patients, what happens in our center, in leading Russian centers, and we are currently forming such a system around all Russia, and it's the main strategy to 2030, and it's gonna be a system gonna show you the way it's gonna be organized all over the Russian Federation, and the surgeons involved in such rehabilitation paradigm could rely on our assistance. As we can see, in the Russian Federation, a three-stage, four-level system is formed in which the patients are subdivided into 8 classes of disease severity, and for the time being there are the 3 rehabilitation profiles, and one of them is can shortly be called neuro-rehabilitation. So this includes the patients after surgical interventions, and they are automatically involved into the neurological rehabilitation scheme. How it happens and what we do within the framework of this model. Here I'm not going to tell you the lot of research devoted to this issue, saying that if we don't do that, we get a lot of complications that lead to significant enlargements in spending. We increase the morbidity, reduce the functional outcome, and obtain lots of problems in such patients and their families, the cities they live in. And for that reason, in year 2007, when we opened our vascular program, we suggested a rehabilitation program that starts in 3 hours after a patient is admitted in hospital. And in case of surgical intervention, no matter what kind of intervention is this, patients get into rehabilitation and ICU unit, and within 3 hours, a multidisciplinary rehabilitation team should step in, and the first stage they define a way they feed the patients, and later on all they have to define what functions they have to restore in these patients. The patients are gradated according to international scales and parameters that have been confirmed by the study carried out in the Russian Federation and abroad. About 30% of the patients who've survived the first 3 days after being in medical ordination are not going to have any rehabilitation potential due to their status. So due to the surgical intervention, these patients have a different kind of problems in relation to their neurosystems and other organs. They are whose the program is aimed at. So these 4 levels we concentrate our rehabilitation efforts from. They are based on the organizations of different levels who have different sorts of competencies, and they're all headed by a national medical centers, and the main facility here is the Ivankovsky Center of the Ministry of Health, and the center we are currently here now is the reference center in The medical rehabilitation, this is the center of third level. These are centers that are different in their level of competencies in the regions of the Russian Federation. These are the centers of the second level, and that bring these help close to their patients live, and they help them either at patients' home or using the innovative distant technology. So these are the three stages that take their patients in the following way. The institutions who provide the hospital assistance, they are mainly organizations of the third or second level, because our country is very large and we have vast area with a low population density, and we have to organize certain rehabilitations efforts there as well. The second stage is gonna present in all hospitals of the Russian Federation of the second level, and as it comes for severe patients we haven't been able to treat within a week, that's the level of our first stage. These are the patients that require 24/7 hospital assistance, and where they can be treated and diagnosed by a rehabilitation team. And the first level also includes rehabilitation team, ambulance, and other medical services to provide all kinds of assistance in order to mitigate the negative effects of diseases and bring patients to their daily life. And every subject of the Russian Federations, we're gonna form a certain logistics network to follow our patients and to provide them rehabilitation. The latest amended version of the order came into being in 2020, and it underlines the philosophy, the way it should be done, and it's currently relied on, in particular the medical institutions. There is no such an institution with multidisciplinary capacity. The regional authorities can send the patients to the federal centers where they could be treated accordingly, and we usually receive like ours, and we usually receive very severe patients, and we started widening the list of the patients we are ready to admit, and that even includes vegetative patients. So our rehabilitation teams, they know no limits and will try to do everything for every patient in any condition, which is a very interesting direction of rehabilitation, especially when it comes to the brain and the central nervous system. What we are working with rehabilitation today is aimed not at a disease but at the functions disrupted, and here you can see the possible rehabilitations option available for patients today. The treatment is individualized, and each patient can be treated within a list of 48 possible rehabilitation program. As for the World Health Organization, their lists include 72 directions, so we have a great deal to be desired. These are the structures we estimate in terms of the patient health. We also estimate the activities and participation, which has never been done before. for, and that enable us to achieve the results that are important for the patients, and give us a way to discuss the conditions with the patients to obtain the results that are essential for them. And in terms of contextual factors, we are lagging behind the United States, where they have quite a developed system of rehabilitation, and we currently have no particular standards to estimate patients' family situation and the social environment that are very essential for patients to rehabilitate. And absent of such a medium is the certain counterindication for rehabilitation. And that's what our rehabilitation teams look like. It includes such specialists, all of them of higher education, both medical and non-medical. Each specialist has a list of their own competencies. They are able to estimate, and they estimate such the parameters as the vision impaired, hearing impaired, movement impairment, and we assessed every patient individually, and we assess their progress, which is marked in gray. We follow certain goals, and the procedures and these procedures should be complex and shouldn't include thus massage or some or singular procedures, and these procedures are to be built in a way to be delivered within a certain time frame and bring a certain result for a patient. So, which means that certain results are to be achieved, for instance, by the end of the week for this or that particular patients. So the methods that are currently used in rehabilitation, there are a lot of them, and within a single day we can offer 6-7 interventions for a single patient, especially those in the ICUs with lots of comorbidities, vascular risk, and with probably not one but several malformations. And in order to make sure we've been able to provide proper rehabilitations, we have to properly assess the risk, and it requires for individualized treatment with assessment of the reactions for this treatment provided. So each members of the team are involved not only in treatment but also in the assessment and diagnostics of the patients. As for diagnostic methods, we try to formalize them. Our 151 beds, including the NCU unit, are currently working in a way to follow the universal diagnostic paradigm to estimate patients' dynamic and provide their proper logistics as their conditions improve, because even if we they postpone this proper assessment, even for a DI, for neurological patients, we do them no good. So our multidisciplinary team has been working day and night, following different methodologies for different categories of patients. Apart from that, there is a marshrutisation principles. Like, for instance, what you see on the slide is that for Sverdlovsk regions, where they carry out all the necessary manipulations, the moment the patients delivered in the rehabilitation center that works 24/7 if their conditions are severe. As for mild patients, they are admitted to day hospitals, and patients suffered of chronic neurological symptoms. We have 250 beds to provide rehabilitations for such patients where they are delivered. For instance, those patients who are on pump for a long time and are in coma for more than 20 days. And as for regional centers, we provide consultations for such centers to improve their patient status and help them to spend their resources more efficiently. And this is a rehabilitation scheme for the Kazan regions. And today, every big city, every the big region has its own rehabilitation paradigm that enable us to reach that two global goals that are very essential to us. The first goal is to achieve the best functional result possible, and we understand as there is a therapeutic window for proper performance of rehabilitation techniques, especially for the severe patients and of old age. It's 21 days, because if you don't do it within this time window, you severely disprove the possible outcome. So for a patient, presence such a rehabilitation team right after the surgery that comes into work right after the operation is very essential. So this is the team that diagnose the patient, and in the future we believe that will have the effect not only what happens to the patient post operation, but also before it. Thank you very much for your attention.